Hello everyone and welcome to Elika Organic Skincare webinar. And this webinar today we are going to be discussing acne symptoms, the causes of acne conditions, and their common treatments and the treatments from Elika Organic Skincare. So welcome everybody. Thank you so much for joining me. I am going to just quickly go through an introduction. I just wanted to welcome all of you today. My name is Jessica Heron, National Educator for Elika Organic Skincare and Pure Spa Organics. If you haven't met me before, here's a nice visual of myself. I wish I could see all of you today, but the Adobe Connect unfortunately doesn't allow us to do that. But maybe someday soon we'll be able to see everyone's smiling faces just like as if we were in the same room. Well, what I thought I'd do first is just do an overview of the topics for today's webinar. Today we're going to discuss start off anyway, with the symptoms of acne, sort of what those common symptoms that acne shares, and also kind of the differences between some of those symptoms as well. And the 4 grades of acne. The 4 grades of acne is a classification system that dermatologists use in order to identify the acne symptoms and also help to prescribe treatment. So we'll be going through the observations of each type of grade of acne, what the condition looks like, what some of those symptoms are, and some of the causes as well. Just defining those for you. And also some of the causes of acne. What are some of those common causes that can bring about the condition and the disease and the disorder, and discuss those as well. Common acne treatments, some of the treatments that are out there available at your disposal today to treat your clients' acne conditions. Some of those common treatments that are used on a day-to-day basis. You know, as estheticians, you see acne coming through your door at all different stages and all different types. So it is good to know what you have available to you to be able to utilize. And some of those treatments can be actually used alongside with the Elika herbal acne treatments that we'll discuss what's available to you through Elika Organic Skincare. And I'll be able to show you, too, how you can utilize your Elika Organic Skincare in conjunction with some of the acne treatments that are out there available today. We'll also talk about, of course, the treatment products and some of the coordinating facial protocols that are also available for you through Elika. And then we'll also be doing a live demonstration of an Elika facial treatment, an acne facial treatment. I'll also discuss with you some of the other options that you can choose as well, besides the one that we'll be demonstrating today, so you'll get a good idea of what else is available to you and what we would recommend. All right, so I thought we'd just start off talking about some of the statistics out there today. You know, 20% of all adults have active acne. Up to 20% of women actually develop mild acne. So 60 million Americans have active acne, which is quite a bit of people, which is a huge door, an opportunity for you to be grabbing these types of clients and marketing to these types of clients in your business as well. 20 million Americans have acne badly enough to cause scarring. And we all know that that can be deforming, not only physically but also emotionally. And that is a long-term thing that people have to deal with after having, the acne lesions. You know, the first stages are the inflammation and the acne lesions, and then what's left over is actually physical and emotional scarring that they have to deal with. And, you know, some of the treatments that are available out there today can help sort of eradicate some of that stress that people go through. Only 11% of acne sufferers actually seek help. They're often treated by family doctors, but not treated maybe by professional specialists like estheticians and dermatologists. Acne is considered a very social taboo. Like I was saying before, it actually will affect people physically and emotionally and become deforming both ways, and is really difficult and stressful to deal with. And this is all statistics that I found according to the American Dermatologists Association. So again, there is a huge opportunity to market your business towards this type of a client, and to be able to have a line like Elika Organic Skincare that provides you natural and organic solutions and an alternative solution to, say, chemical ingredients and synthetic ingredients. This will still give you effective results-driven products, just as all the other products in our product line. But then you're able to address something that affects a huge population of the country. So this, again, like I said, is something that you can utilize to your advantage and market to your business to these types of clients and help draw them in your door. All right, so let's define acne. Mayo Clinic defines acne as a skin condition that occurs when your hair follicles become plugged with oil and dead skin cells. And that directly affects the follicle's ability to introduce oxygen into the skin. And that can, in turn, be a breeding ground for the acne bacteria. Acne vulgaris is the medical term for acne and is the most common skin disease, and the most common type of acne, I should say. Commonly appears mostly on the face, on the neck, the chest, the back, and the shoulders. So typically we see it on the upper half of the body, starting on the face usually, and it can progress down onto the body area, typically the upper body. Lesions heal slowly, but when one begins to resolve, others seem to crop up. It's almost like it's a spreading infectious disease almost, is what sort of starts to happen. And depending on the severity, acne can cause emotional stress that leads to the scarring of the skin and leaves those permanent damages as well. And it also causes very emotional distress because of the physical scarring. So like I mentioned earlier, people are dealing with not only having to control the disorder, but also have to deal with what comes after it. So there's many stages into treating the disease. In the beginning, we want to treat inflammation. We want to also reduce the amount of lesions that can occur, and then have to deal with any scarring that may be permanent that's left over after the inflammation has cleared up. Effective treatments are available. There is no cure for acne, right, at all. But, and really, we know the causes, but we don't really know exactly why acne occurs. But we do know some of the causes. We do know what can trigger the condition and what makes it worse. And there are effective treatments available either through dermatologists, professional doctors, physicians, and then also through aesthetics, so seeing and seeking out professional estheticians to help treat the condition. And of course, many plethora of different products are out there on the market today that will address those issues as well. But the earlier the treatment will lower the risk of lasting physical and emotional damage. It's like with anything, with any kind of disease or disorder, if you catch it early, you can actually, and start to treat it early, in its early stages, you can really lower the risk of any permanent damage. So that's really what we want to encourage people to do, is when you start to see it, especially in the first stages, talk to them about the condition, talk to them about what are the causes, and educate our customers and clients on how to deal with the disease and how to treat it, and the best options that they have that you can give them. And if you don't have them, help them along the way. Of course, make suggestions. Even if they have to seek out a doctor, help work with their doctor. So you and the doctor help along the way. Okay, so let's just overview causes, symptoms, and treatment, just in a nutshell, before we start getting into more detail. So some of these causes that we know of that can disturb the condition and also cause bacteria to sort of well up in those follicles that create some of those acne lesions to come out, is oily skin. And that's overactive sebaceous glands and a high level of bacteria and dead skin cells that are within the hair follicle itself. That's where it begins. Hormonal imbalances, adolescent and adult acne. These are some of the causes that we're going to overview and detail a little bit later here in the presentation. Hereditary factors, people who are predisposed to the condition. It's in the genetic makeup. Environmental factors, environmental stresses like the sun, heat, humidity, just to name a few. Some of the symptoms that we notice are oily or even dry acne, like seborrhea conditions. And a lot of times with seborrhea, we know inflammation has also comes to play. And inflammation is kind of what eggs it on, the oily skin plus the inflammation making the condition worse. Non-inflammatory and inflammatory lesions, excuse me for the mispronunciation, but we'll be talking about the differences between these types of lesions and the treatments for them as well. Comedones, like clogged pores, whiteheads, blackheads, papules, pustules, cystic nodules that are deep in the sebaceous glands where they begin and become swollen and hard and very painful. Some of these other ones, like comedones that are closed and not closed, may not have as much inflammation, but we'll be overviewing each type of symptom and what those look like and what to look for so you can tell the difference between the two, or between all of them, sorry. Redness, irritation, inflammation, scarring. That would be that raised scarring or even pit scarring. Mostly face or upper part of the chest and the back. So some of the treatment options, of course, are anti-inflammatory products. Some of those over-the-counter treatment products that we would utilize to help decrease inflammation, decrease the irritation, the redness, and the soreness from the condition. And then also antibacterial ingredients, which are, again, products in our line and other lines that will help to cut the bacteria and reduce the amount of acne lesions that can come out because of the condition. And also there are going to be some other medical treatments as well that we're going to overview that are kind of borderline as well as far as between aesthetic and medical, and then also just quickly overview some of the medical options out there as well, and that you can assist with too. This is just an example. I know we're going through a lot of pictures here that are kind of, not so happy to see or happy to look at, but as estheticians and studying the skin, we do this all the time. We'll be looking at the differences between the condition and what they look like and some of those symptoms. Types of acne symptoms. So let's talk about kind of where they start. We've got some closed comedones and we've got some open comedones. The difference between the two, as you can see in the diagram here, open comedones are blackheads. And then you have the closed comedones, which are typically called whiteheads or melia. Blackheads are called comedones, but we typically say comedone for a blackhead, but actually there's a difference. There's an open comedone for a blackhead, and the whitehead is the closed comedone. You can see here, this is a picture of the follicle where the hair shaft is and the papilla down at the bottom where your sebum and oil glands are. And you can see when it's an open comedone, there's an opening, and then it starts to fill up with oil and debris and makeup and oxygenates because that open pore allows oxygen into the pore actually, and that oxidizes all of the oil and makeup that's inside, and it sort of becomes brown or black. And then you have a closed comedone, which is the whitehead. So there's an actual little small bump on the top. And there's a lot more fluid on the inside, as you can see. A lot of times there's not as much inflammation associated with the open and closed comedones at this stage. Non-inflammatory lesions is what I'm referring to. And that means that there's still a blemish there, but there isn't the redness and the soreness that is associated with the inflammation. Then open comedones or blackheads, they pretty much hold all the debris retained by the follicle. And they rarely develop into the inflammatory lesions. Unfortunately, the same can't be said for the closed comedone. So the open comedone rarely develops into an inflammatory lesion, but your closed comedone that has the little red bump on the top has the more higher chance of becoming inflammatory. And the reason is because it's closed, which prevents the oxygen from penetrating the follicle. I mentioned before how the oxygen gets into the open comedone and it turns the congestion inside the pore sort of brownish or blackish. So we know there's oxygen getting in. But when the oxygen cannot get in, that's a problem. And that's when the inflammation can occur. The walls of the follicle stretch. It holds the contents of the impaction, as you can see down here below in the diagram. But the follicle opening does not. And because of this lack of oxygen, the lesions can easily become inflamed, of course, due to the increasing number of bacteria multiplying in that environment. So that can turn into not such a good thing. Open comedones rarely develop into the inflammatory lesions. Closed comedones, the whitehead, small underground bumps, and they don't really extract very easily. We know open comedones can extract a little bit easier, but the closed comedones, not so much. There's a lot more work that has to be done in order to get that to soften and open up. Usually that's going to take a little bit of treatment to do that with. The closed comedones may develop into inflammatory lesions because of the reasons we had just mentioned. That's the lack of oxygen being able to get inside the pore. Okay, some other types of acne symptoms would be papules and pustules. Here's a fun diagram of a papule. Again, we have a picture of the follicle here where the pore is located. You have the skin surface, you have the actual papule or the bump, enlargement of the follicle opening, the sebaceous gland where the oil is produced. There's the follicle where the hair comes through and then comes out the top. And you can see where the fluid is starting to build up underneath the surface of the skin. Papules are a red sore bump without a whitehead. The white blood cells come to the surface and forms a clump and rises to the surface, creating a pustule. A papule is red, it's sore, and it's the beginning of the rescue of white blood cells. So they form, and then they form this little clump that you can see in here, and then it rises to the surface that creates that bump or that pustule. So it kind of goes in stages. At first it's a papule, and then it becomes a pustule. Papules never come to a head and disappears easily due to the immune system disposing of the impaction through enzymes and absorption. They also seem to magically disappear. They tend to not rise to the surface and actually become a head. They sort of hang out, stay around for a little bit, and then all of a sudden they're gone. And this is because the immune system has won the battle and disposed of the impaction through enzymes and absorption. And that's exactly what we're mentioning now. And the body has disposed of the remains through normal blood excretion. Increased soreness because they are deeper and they're more closer to the nerve endings. And a pustule, when it rises to the surface of the skin, and if we can draw that out, it actually releases a lot of that pain. Pustules migrate toward the surface, dilating the follicle opening, and then relieves the pressure, so this results in less pain. And so, at this point, is a good time when this can be, it's a good time for it where it can be removed or extracted, because there's not as much pain, and it's also come to the surface, and the skin can be softened or exfoliated or disencrusted to aid in removing an extraction. The next stage of a pimple, there's another little diagram where you can see the differences between the papule and the pustule. So you have the papule that's sort of not really rising to the head. Then the pustule comes up to the surface where all that fluid starts coming up, and it also accumulates even more fluid, but it migrates up toward the surface. It helps to dilate the follicle opening. As you can see, at the very top of the pustule, it starts to dilate that opening. All right, let's talk about nodules and cysts. We love those. Those cause a lot of pain and a lot of damage. And at this point in time, when you start to see nodules and cysts, this is a very serious stage. And a lot of times when we see these types of lesions on the skin, it's not a bad idea to start to refer these types of clients to the dermatologists and physicians. So, nodules and cysts are similar to a papule, but it is deeper in the skin and feels very solid and very sore. So you can see there's marked inflammation here. You can see it here, the redness in here, up at the top and also down below by the hair follicle. And it's present in addition to erythema and also tenderness. The follicle wall bursts, and a capsule is created via enzymes secreted by white blood cells to contain infection. So it's kind of like a defense mechanism, but it can also create, and that's what inflammation does, is it helps to, the white blood cells come up to go to the infection or go to the wound and create inflammation, and it is a defense mechanism. But that creates soreness, and it creates redness, and it doesn't make it look very good at all. They're deep infections caused by a deep, massive invasion of the white blood cells, exactly what we're talking about right now. You can see them all. And also, cysts are very pustular, and they're also very, very large. And this time is really a good time to start referring these forms of acne to a dermatologist for further treatment. Although treatment with the esthetician shouldn't stop. One of the things that you should do is when referring them to further treatment is work with the physician, work with the doctor, and talk to them about treatments that you can continue in the spa and in your practice, because they only see the doctor once in a while. There's a lot of things that the esthetician can do to maintain and prolong the positive effects of their treatments with the doctor. So work with them. Not a bad idea to hook up with a dermatologist that you can reference to and work with. I'm sorry, one more thing is the likelihood of scarring at this stage is very high. And this is sort of where you can get the raised scarring, but also the pit scarring can also happen because of the deep sebaceous activity causing all of the damage inside the follicle. So types of acne symptoms, we'll talk about lastly scars. The skin produces collagen to compensate for the lack of normal skin functioning, causing a raised scar. It's a desperate attempt to heal itself, is what this collagen production is what's happening. And it's trying to compensate for the lack of normal skin function. Acne pit occurs from actual destruction of the tissue during the inflammatory process. Cystic acne is almost always associated with this type of scarring. And we'll see different types of raised scarring, and also, which is more of a darkening or a pigmentation in the skin, and then the pit scarring, which can be much more deforming and much more permanent, and much more difficult to control as far as reducing the appearance of the pit scarring. It can last for years or a lifetime if it's untreated. There are treatments today that will help improve the appearance of the pit scarring. And those are going to be some very invasive treatments that are going to have downtime and a lot of maintenance in between as well. So now that we know some of those symptoms that differentiate between themselves, the different kinds of lesions and things like that, understanding the different stages of acne will help and assist in prescribing treatment for your clients. So let's talk about that. Dermatologists classify the types of acne into 4 grades. Types of non-inflamed comedomes that are present, types of inflamed comedomes that are present, so both the non-inflammatory and the inflammatory lesions, the amount of breakout activity and how frequent, the amount of inflammation, if there is any at all, the areas of the body that are affected, face, neck, body, chest, wherever it may be, and then knowing the grade of your acne is the first and important step in treating acne, and all grades require different treatment methods. So when you understand, okay, this is what's happening in this stage, and this is what this type of lesion is that we just went over what they are. We went over what kind of acne lesions are what, and kind of how they function and how they get there. And that will be the first step in knowing what to recommend. But we'll talk about those treatments and how to utilize those treatments to treat those types of lesions. But we're talking about the 4 grades of acne now. Now, grade 1 is the mildest form of pimples, but they are small blackheads and amelia with no inflammation. Grade 2 acne, very large number of closed comedomes with occasional pustules or papules. So here's a picture of the grade 1, and you can see that it's visible, but not something that's super noticeable. And it's the mildest form, but probably the most common teenage acne too as well. They're small pimples, they're closed comedomes, they're open comedomes, small blackheads, and a little bit of closed comedomes with no inflammation associated with it. The grade 2 has a little bit more action happening. You have a very large number of the closed comedomes with occasional pustules or papules. So you get a little bit coming out more, a little bit more inflammation starts to happen at this time. So grade 1, commonly seen in an early adolescence, especially in the nose and in the forehead. Many adults also experience grade 1 acne as blackheads on the nose and on the forehead. Amelia are commonly found in the eye area and maybe in the chin. And grade 1 type of acne can be successfully treated at home using over-the-counter products that contain maybe salicylic acid and antibacterial products. And you generally see results pretty quickly. Grade 1 acne may progress into grade 2 if it is left untreated. Now, grade 2 is considered a little bit more moderate acne. There will be blackheads and amelia, generally in greater numbers, and you'll start to see even more papules and the formation of some pustules in this stage. They will appear with greater frequency, and general breakout activity will be more obvious. Slight inflammation of the skin is now apparent. So you will start to see some of that redness, that irritation, and that inflammation start to begin. In teens, you may see the acne progress from the nose, from the forehead to the others, the face. So it starts to look like it's spreading around. And then also acne may start to affect the chest, maybe the shoulders. Also occasional breakouts even on the back, especially in males. Adults, women may find greater breakout activity around the cheeks, the chin, and the jawline area, especially just before during your menstrual cycle, which we obvious women know how fun that is. But again, it's that hormonal change, which we're going to talk about as one of the causes that affects our sebaceous activity, and we'll talk about how that works in a little bit here after with the grades of acne section. Grade 2 acne can still be treated at home using over-the-counter products, but like antibacterial products like salicylic acid are common, benzoyl peroxide. Those are help to kill the bacteria that causes inflamed breakouts. One of the things that if after several weeks of treatment at home the acne doesn't significantly improve, it is maybe at this time too a good time to seek out the help of a doctor. But also at this time you may be able, as the esthetician, get it under control if they're committed to the treatment. You may not have to go that far to see the doctor. If grade 2 acne can possibly get to grade 3, especially if there's a habit of the pimples being picked or squeezed. So try to, at this time, encourage the customer, leave your fingers off the skin. Don't touch your skin, because at this time is when they want to do that. They want to pick up their fingers and they want to start picking and prodding at the blemishes because they want it out. But that would be the worst time to do that, because what will happen is bacteria gets in there from the nails and dirty fingers, also not extracting properly, and the congestion being forced back inside the follicle because the extraction is not done right, and causing infection. So it's best to try to encourage them to not try to pick and prod. Utilize your topical products and your facial treatments to control the problem, because we don't want this going into grade 3. Grade 3 is what we're going to talk about next, grade 3 and 4. Grade 3 acne is typical of teenage acne. It's very inflamed and red, involves a large number of open and closed comedones and many papules and pustules. Grade 4 acne, cystic acne, with many deep cysts and scar formation. As you can see in grade 3, this type of acne is considered severe. It's the main difference between grade 2 and grade 3 is the amount of inflammation that's present. The skin is now obviously reddened, very inflamed, and also papules and pustules have developed in a greater number, and nodules will also may be present as well. Grade 3 usually involves other body areas like your chest, your neck, your back, upper back, as well as the face, and the chance of scarring becomes even higher as the infection spreads and becomes even deeper. A dermatologist should treat acne at this stage. Grade 3 acne is usually treated with both topical and systemic therapies available only by prescription. If left untreated, grade 3 acne may progress to grade 4. If they're seeing a dermatologist and taking medical prescribed medications, that's something you need to discuss with the doctors too. You need to know and be informed of what they're taking, what the contraindications of certain treatments that you provide may come into play too when you're treating somebody who is on medication. Grade 4 acne, cystic acne with many deep cysts and scar formation. So this is the most serious form, and it's often referred as nodular cystic or cystic acne, of course. The skin will display very numerous papules, pustules, and nodules in addition to cysts. There's a pronounced amount of inflammation, and breakouts are severe. Cystic acne is very painful at this point. Usually extends beyond the face and may affect the entire back, the chest, the shoulders, and the upper arms. Nearly all cystic acne sufferers develop from scarring because it's so deep and it has damaged tissue. Grade 4 acne must be treated by a dermatologist, and it requires powerful systemic medications in order to control the condition. Another thing, though, too, is I don't think at this point that you even have to rule out the esthetician's work. I think a lot of what estheticians can do is heal the skin and then control that inflammation. And I think that's part of your job at this point, is to help control the inflammation and make suggestions that would help them reduce that inflammation and recommend the right home care and the right products in order to assist in this treatment with the doctor. All right. So let's talk about some of those common causes of acne. All right. So one of the first things I think that we all know can cause acne is oily skin or hyperkeratosis. They're both hereditary factors, and hyperkeratosis is dead skin cells that stick to the surface of the skin and line the inside of the walls of the follicle, occurring at a very abnormal rate. And that buildup is what can cause an oxygen deficient environment, and that feeds the bacteria to grow. Excessive oil waxes over the cell buildup, is what we were just kind of talking about. Sebum solidifies, forms a small impaction, and a mix of dead skin cells, bacteria, fatty acids, and other debris clog the pores. This is the beginning phase of an acne lesion. So that's kind of where it starts. And there are triggers for oily skin, certain environmental factors, hereditary factors, and also hormonal changes also in the body. So those are some of the few factors that can trigger that oily skin to start. Hormonal imbalances, and which is very, very common. Hormonal imbalances like an estrogen imbalance, which would be females, a decreased estrogen, which is a female hormone. Those decreased levels of estrogen result in a dominant androgen or male level of hormones. Fun. That's so much fun. Sorry, I didn't mean to back up there. Androgens cause stimulation of the sebaceous glands, which causes more sebum. So basically, males and females produce both male and female hormones, which are transported around the body via your circulatory system. Hormones, specifically male hormones or androgens, are the mechanisms that cause stimulation of the sebaceous glands, which in turn produce even more sebum. The sebum causes inflammation in the follicles, and then it also coats cell buildup, and then provides a source of fatty acids, which is the food for the acne bacteria. So, androgens cause stimulation of sebaceous glands, which causes more oil. Sebum causes inflammation in the follicles. And we were just talking about how it coats the cell buildup, which provides those fatty acids that feeds the growth of the bacteria. So testosterone converts to DHT, which switches on the oil gland. Premenstrual acne flares often occurring in women in their 20s and 30s, caused by a sudden predominance of androgen. So what we're talking about with the DHT is another form of the male hormone. It switches on the oil gland. The oil gland is then stimulated via receptor sites of the cells of the sebaceous glands, which are like little switches that are turned on and off by hormonal stimulation. Now, premenstrual acne flares often occur between the women in their 20s and 30s. This is a predominance of androgen. So often women that have never had problems with acne as a teenager will develop a problem in their 20s and 30s, and we see this all the time. I have had, in my practice, I would say that more than half the women that came in with breakouts had all the same story to tell. Never had any problems in my teenage years, but now that I'm in my 20s and 30s, now I'm starting to break out. This can be related to comedogenic cosmetics, stress, hereditary factors, and hormones that play a significant role in adult female acne. I would think that there's a very common cause in women that come in this age group, and that, you could take a look at that being one of the causes. Stress can cause the brain to manufacture a hormone that causes the adrenal gland to make more hormones, that causes more oil to be produced. So stress is another factor that can take a play in the condition of the skin. And if we're already prone to acne breakouts, stress in the life can also play a role. And so de-stressing in your lifestyle can also be something you can work on with the clients and helping them de-stress and finding different ways to do that. And a lot of times things happen in their personal lives that cause the stress. That can also make their problem even worse. So assisting your clients in de-stressing can be a very helpful thing. And many acne sufferers have noticed acne flare-ups in patients that are under stress. So that would be, like I mentioned before, something important to address in your treatment. Find out how much stress they're going through. Also, pregnancy. Pregnancy may be a cause, but it's usually worse in the first 3 months, and then it gets better. The usual course is that this is the usual course. It may flare up again after childbirth or after breastfeeding is discontinued. Theoretically, this is due to obvious hormonal changes, but stress levels may be partially responsible as well. So that could be another common factor. And also menopause, permanent hormonal changes. During menopause, similar hormonal changes are very prominent, and those cause flares too as well. Because menopause is a time more permanent, where there's more permanent hormonal change, some women experience even more acne flare-ups and other androgen-induced symptoms, such as facial hair growth, which you know to be very common. Especially if you wax a lot of clients, you'll notice that under the chin area or around the chin area, there's sometimes some unwanted hair growth there that happens around the time of menopausal periods in a woman's life. So that can also be a cause of breakouts in acne as well. Also some environmental factors. Heat and humidity causing swelling of the follicles, and also sun exposure causes cell buildup. That really can produce a lot more oil and bacteria that can take place in the follicle as well. Tanning makes redness, covering up the acne condition. You're basically covering it up instead of dealing with, a lot of people go tanning and they'll do the tanning thing to help even out the skin tone and skin color tone, but what happens is they're actually covering the condition up. And after tanning, the exposed clogged pores that have gone untreated, because they were like covering it up and they weren't doing anything, is actually worse. Also, greasy workplaces aggravate and worsen acne conditions as well. So those are just some of the environmental factors that can take place, that can kind of egg it on and make it worse and cause the condition to become even worse. So here's some common myths about acne. Some of the common acne is like chocolate. Chocolate really isn't actually aggravating any type of this, isn't aggravating this condition at all, and doesn't cause any type of acne. Actually, chocolate, if it's in its raw, dark cocoa form, is really high in antioxidants and has a lot of nutritional value for eating. So that's a really bad myth. And I'm glad it's a myth too, because chocolate is wonderful. Also, nuts. A lot of foods tend to get blamed. One of the only ones I think that could get blamed that may be true is dairy. Seafood, greasy foods, candy, fat and milk. Foods are not the culprit. But, if there's an allergy, that's a whole different story. Because there can be an intolerance and an allergy in the body, and that may cause a problem. And it'll cause inflammation, and it may cause worse things too. So that's a little bit different. It's not, it's not an allergy. If it's an allergy, that's different. But commonly, these are some of the myths that we see out there. Foods are not the culprit. Usually, it's mistreatment and poor hygiene that usually is a common cause of acne. And, of course, hormonal factors as well. So what are some of the common treatments? Some of the common acne treatments include, and there's a lot more out there too that may be, something that I'm not mentioning today, but there's a lot of new treatments and a lot of new technology out there, and there's a lot of machines and equipment that can help along the way. Well, one of the things that isn't a machine or not an equipment that we can use with product is our AHA peels or chemical peeling. These are beneficial to help loosen both surface cell buildup and also impacted dead skin cells that are inside the follicle. So regular treatment can help to reduce the bacteria and this dead skin buildup, but also help in improving the scarring formation, like red raised scars and also pit scarring. Now, if you're going to help to address pit scarring, your chemical peeling is going to be much stronger and much more regular. Now, if there's just like the non-inflammatory lesions, you can do this very successfully with these types of treatments. The worse the acne is and the more inflammation, I would deal with that first before I start peeling and refining the skin in a more aggressive manner. Of course, regular exfoliation is important and part of the maintenance, but it depends on the strength, depending on where you are and what stage of acne you're in. Now, if you're in the higher stages of acne, very red, very inflamed, you're going to have more gentle treatments with more focus on reducing inflammation. Now, if it's more grade 1 and 2, your treatments can actually be a little bit more aggressive because there's not as much inflammation, especially in grade 1. Now, then you can be a little bit more aggressive. But if there's a lot of inflammation, that has to be dealt with first. Disincrustation. With enzymes, or like disincrustation, for example, with enzymes, these are protein-dissolving products that work to destroy the keratin in dead skin cells and on the surface of the skin, and it's the perfect tool to prep the skin for comedome extraction. So this would be something you can use to work to soften the pores, soften oil and oil impaction, like comedomes, like open-pored comedomes. Those would be great to do pre-extraction. Comedome extraction. Manual extraction of comedomes cuts bacteria and also reduces the size of the pores. So it'll help to tighten the pores, plus reduce the amount of bacteria that's being built up in the pore, and helps to prevent those, the first stage of that, when we were talking about comedomes, how, especially if it's a closed comedome, has more higher risk of becoming an actual like pimple and pustule, or something that's an inflammatory lesion like a papule or pustule. If you extract these comedomes and properly extract them and be clean about it, and practice very good practice safety and sanitation along with the comedome extraction, you can be successful with preventing some other future stronger or future worse grades of acne. Microdermabrasion. This is an alternative to chemical peels, especially strong, oily, thick skin. The treatment will assist post-acne when the inflammation has subsided, one of the solutions that will assist in reducing the appearance of scarred skin. That can be an option to utilize afterwards for you when you see any type of scarring on the skin. It can be something you can utilize to help improve that the permanent damage from the acne disease. LED light therapy. This is called light-emitting diodes. It triggers a biophotochemical response. What it does is it's activating cellular metabolism. They are color-coded proteins called cytochromes that assist in electron transport. So these devices include little panels with little tiny diodes that are pulsed at in a very excessive array sequence. So knowing the different sequences is very important to understand the sequence of any of the devices that a company may offer. And also the sequence, they'll have different colors like blue or red or amber or orange. And so those little pulse sequences are different in each color, but the colors help to differentiate between which sequence is what. And the manufacturer of that equipment will be able to help teach you which light is for what. Commonly, the blue light is what the light is used in acne treatments to really aid in cutting bacteria and helping to improve the acne conditions, and also help to improve after, post-acne when there's scarring. Prescription drugs and topical and oral drugs. There are topical antimicrobial and anti-infective drugs, and oral anti-infective drugs that are used to treat inflamed nodules. There's also oral estrogen, progesterone, which is often used to treat acne in women. Now, some of these are topical, like I mentioned, and some are oral, and depending on the grade of acne, will be, will decide what type of medical oral drug the doctor may put the client on. So it depends. Now, the stronger antibiotics, definitely, like when they're oral, are a lot of times used to treat the inflamed nodule. So this is when you're getting into grade 3 and grade 4 acne. The topical medications may be something also prescribed, but tends to be maybe around grade 2 or grade 3 acne. Then doctors will go to the stronger forms of antibiotics that are oral to treat grade 4 acne when it becomes more of a serious medical condition. And then you have your Elika Organic treatment products as well and ingredients. So let's overview what Elika Organic Skincare offers you. We have a lot of different herbs that we use in our Elika Organic Skincare products, and also treatment and treatment facials that will assist you with treating your clients. The ingredients include anti-inflammatory ingredient like walnut leaf, anise, fennel seed, and clove oil. These are herbs that also have anti-inflammatory benefits, but also have hormone balancing effects. They have naturally occurring estrogen effects, so that will also assist with any of those adult hormonal acne in women. And also our pigment inhibitors, like anise is a pigment inhibitor that slows the darkening and scarring of the skin. Horsetail is another one that we use for softening, remineralizing, and helping to reduce the amount of impaction in the pores, but also is an anti-inflammatory as well. Yarrow is a wonderful botanical used for its medicinal and healing properties. It's a strong anti-inflammatory, and it's used for hundreds and thousands of years for its medicinal and anti-inflammatory and wound healing properties. Shea butter is very healing, hydrating, and very protective, but it also creates more of a matte finish to help cut oil. Peppermint is very soothing and cooling. It calms and reduces pain. And then paprika, Hungarian paprika. Paprika is used in our product line for its estrogen and hormone balancing effects, but it also has anti-inflammatory benefits and oxygenating benefits, so that helps to cut bacteria and delivers nutrients and drives nutrients deeper and faster into the skin. Ictamol is an ingredient that's used in our acne line. It is a drawing salve or a purging salve. It is a mineral shale that's natural from the earth. And ictamol is a wonderful treatment because not only is it anti-inflammatory, antibacterial, and antifungal, but it's also drawing. So it draws impurities to the surface. So if you have cystic acne, a deeper sebaceous nodular cyst, or even a boil, it's wonderful for drawing acne and impurities to the surface of the skin. Honey is an anti-inflammatory, but also a wonderful hydrator too as well. It's like liquid gold. Zinc and sulfur. Zinc and sulfur are very soothing, very anti-reddening, and anti-inflammatory. Aloe and stonecrop are very healing and regenerating, and also stonecrop is a brightener and a skin lightener. Apples are high in malic acid, so an alpha hydroxy content to really soften and refine the skin and help to reduce dead skin cells. And also vitamin content in all of these, but apples are high in antioxidant benefits as well, vitamin content like vitamin C and A. Lemon has a brightening and a bleaching property, but also it's a toning and it's astringent, and it's also very tightening for the pores. And then rose hips are high in vitamin C, a very nutritious herb, very soothing, very calming for the skin, can also help to address even conditions that are associated with acne like rosacea and help to constrict dilated blood vessels and tighten those up and just provide a soothing and a calming effect with antioxidant properties. Plantago is another plant that's similar to the healing benefits of other herbs like yarrow and walnut leaf and horsetail. Plantago is a very strong anti-inflammatory, very anti-irritant, anti-itch, really nice for wounds and cuts and burns and things like that. So for acne conditions, it's wonderful for soothing and really healing the wound as well. So the overall benefits are just kind of those things I overviewed, and that's going to be the next thing that pops up here. I'm sorry, I went past it a little fast there. But the overall effects of all of these herbs are to help reduce inflammation, heal the acne and the wounds. They're very antibacterial, very antimicrobial, soothe pain, cool, calm, hydrate without heavy oils, normalize sebum or oil production, hormone balancing, and reduces the appearance of scarring. Some of the products that you can use in our product line, beginning with the Ictamol line. This is exfoliating wash, the mask, and the spot treatment. Ictamol is commonly used in an ointment as like a drawing salve, as we mentioned earlier. It also has an anti-inflammatory, bactericidal, and fungicidal property. You can find this ingredient in Alike's Mineral Exfoliating Wash, which is a daily exfoliating wash that you use twice a day, morning and at night. It can also be used in the body for back, neck, shoulders, and chest. So we're talking about how acne sometimes it's not just on the face, but it can also be found on the body as well. So that would be a good cleanser to cleanse with on a daily basis that provides you anti-inflammatory, soothing and calming effects, antibacterial, and has soothing lavender that's enhanced. It's a very alkaline or high pH wash, so you get a nice softening effect and a light exfoliating effect on a daily basis. Then you have your Ictamol and herb mask. It eases pain and itch, it soothes, it's anti-inflammatory, it heals wounds, and it strengthens the keratin layer. You also have the herbal spot treatment. It's very similar to the mask with a healing and a drying effect. And it's a daily spot treatment that provides a covering benefit as well. And because of the zinc in both the mask and the spot treatment, it's almost like a natural sun defense, more like in the spot treatment, because you'd be wearing that like under makeup on a daily basis or by itself or whatever. Mask you can use more of at nighttime treatment, and you can use it in a spot treatment at night too, the mask. But it would be like a clay treatment, and it helps to control oil production. 7 Herb Mask. 7 Herb is amazing. This mask has properties that reduce appearance of redness and inflammation, and increased redness from intense extractions or welts or inflammation. Like the client, when you're doing deep extraction work on, it helps to soothe it right away. You have herbs like aloe and stonecrop and spearmint and plantago and zinc and sulfur that will assist in reducing the inflammation and redness. It's a weekly mask if it's used at home that can be used once or twice a week. And you can utilize this mask in like a deep cleansing facial or even following an AHA fruit peel or paprika treatment. Herb Infusion Serum. Herb Infusion contains anise, fennel seed, and clove oil. Anise oil can also help oil production in your skin. It's also hormone balancing. It has bactericide and pain-killing effects. And it's also beneficial for inflamed skin that's affected by the acne. It slows the oil production as well. Fennel has soothing and anti-inflammatory effects on skin that may be seborrheic and acne-prone. Oily skin is often used to, or clove oil is often used to relieve pain as well. So it's a very soothing herb. It's used for antimicrobial and antifungal effects. But all 3 of those herbs, anise, the fennel seed, and clove oil, all have hormone balancing effects as well to regulate that issue. And it's a spot treatment, not a spot treatment, I shouldn't say spot treatment, it's a treatment that you can use underneath a moisturizer every single day, or in a client with very oily skin condition could also use it as a substitute to a cream or a moisturizer. If it's a little bit too hot and humid outside or the condition of the skin is severely oily, I would just use this as an oil-free hydrator. The sulfur line. You have sulfuric exfoliator, sulfuric whipped moisturizer. Now these are both 2 different types of products and product categories, but contain very similar types of ingredients. The exfoliator has zinc and sulfur, and the remineralizing and the softening effects of the sulfur will also assist with a gentle exfoliation. It can be used as a gommage exfoliator, or it can be used simply just to sit on the skin and softly work in exfoliating the skin, or gently exfoliating. And then also can be used as a dual mask product to reduce inflammation and redness and help to reduce bacteria by also helping to control oil. The sulfuric whipped moisturizer has been whipped for hours and hours, up to 7 hours, to create a very fine, a very light whipped textured moisturizer. It is a shea butter based moisturizer, so it will assist with controlling oil production and helping to keep a more matte finish, and it will also soothe pain and inflammation with peppermint. So this moisturizer would be number 1 for our cystic acne clients and somebody with a lot of inflammation. Spot treatments. Spot treatments with like herbal clay and paprika. We talked a little bit about the spot treatment just a minute ago, but the paprika is a wonderful product that assists with comedone softening. So it's something that's used as a nighttime spot treatment. So we'd use it at night in between treatments to assist with reduction in comedone formation and also the extraction process. Paprika is known as an emulsifier, so to really help to soften the impactions in the skin. Because it creates somewhat of a stimulating effect and it raises the body heat elevation, you will probably want to more than likely use this more of a nighttime treatment and then use the herbal clay more of as a daytime treatment. EVK for Men Aftershave. This is actually a wonderful product that has anti-inflammatories like lavender and rosehip, which also increases the vitamin content. But because of its strong anti-inflammatory effects, it can be used for male conditions. It will help to control oil and acne, and it's very antibacterial, but also its soothing and calming effects and helping to reduce inflammation is very, very strong. But it's in a serum, so it'll be made to go underneath the moisturizer or used as a oil-free hydrator. AHA fruit peel treatment with the Hungarian paprika. This is one of our EVK signature treatments. It provides you with fruit acids that have a progressive exfoliating effect that improve the overall complexion of your skin. You can find fruit acids blended in a high concentration with the AHA fruit peel. It has a strong exfoliating effect by dissolving keratin layers on the surface. It restructures and rejuvenates the skin and cleanses from the inside out. And it also has a lot of antioxidants that are natural because of the fruits. You know, you've got apples and lemons that provide you vitamin content of vitamin C and A, and you also have bioflavonoids and polyphenols within the fruit peel. We have glycolic acid, salicylic, lactic, malic acids, and the lactic acids are wonderful for helping against pigmentation as well. But combined together, you have a 20% fruit peel that provides that strong exfoliating effect. Hungarian paprika gel treatment. Now, they go together. Now, the two products are used as a layering process by applying the Hungarian paprika gel over the AHA fruit peel. This together results in an immediate beautifying process, but an immediate stimulating effect. And it elevates the body heat and blood circulation, and a high level of detoxification can occur and provides an oxygenating effect, which is very, very antibacterial. As we learned earlier, bacteria cannot live in an oxygen-filled environment. The absorption increases and the active beautifying process becomes more visible. Deep penetration glycolic peels results in a velvety, a more smoother, rejuvenated skin, and it glows for days afterwards. A series of treatments is highly recommended for the best effects of this peel. You can start with a recommended frequency between 6 to 10 treatments. Recommend the proper home care to use in between the treatments, of course. And of course, proper hygiene is, again, highly recommended. Hungarian paprika treatments, which we just talked about. Also, just back up a little bit, the Hungarian paprika treatment, even though it's stimulating, a lot of people confuse this with the fact that you can't use it on sensitive skin. I wouldn't use it on anybody who has like surface sensitivities like sunburn or windburn or chapped skin or cuts or abraded skin or waxed skin. You can use it on somebody sensitive like acne and rosacea because of the simple fact that it provides anti-inflammatory benefits. The capsaicin, which is naturally occurring in Hungarian paprika, the cherry peppers, is stimulating, but it also provides anti-inflammatory benefits and soothing pain. It also has added anti-inflammatories like horsetail and lavender, to name a few. Those are enhanced to balance out the stimulating effects of the pepper, and it provides you with anti-inflammatory effects. Phytoestrogen line. Our phytoestrogen line, like the serum, the gel, the mask, and the moisturizer, plus this also has a facial treatment, the phytoestrogen line. We do have a phytoestrogen facial. But these have phytoestrogens like cloves, flaxseed, hops, and yucca. Also paprika is another phytoestrogen. These will provide hormone balancing effects and sort of introduce estrogen into the skin and into the body to regulate hormonal imbalance and help to cut the oil production by balancing the hormones. Apple and lemon gel, or apple and lemon line, that would include our lemon cleansing milk, our apple lemon gel mask, and our apple lemon whipped moisturizer. Because these products have somewhat of a refining or a soft exfoliating effect from the apples and the malic acids, this is a wonderful product for someone who's acne prone, but it'll also help to address pigmentation or raised scarring because the lemon provides you the brightening and bleaching effects. So this is wonderful for someone who is experiencing the darkening of the skin, but also may be concerned of oily problems as well because it'll also be very helpful at regulating oil production. The rosehip line, you have your rosehip exfoliator, your rosehip gel mask, and your rosehip whipped moisturizer. Although this product line is number one for our rosacea clients, clients that have rosacea associated with acne or have that papular rosacea will benefit from using our rosehip line. They have more of a lighter, more mattifying sort of finish or texture, and also have clarifying benefits as well, especially in the exfoliator. You have a little bit of brightening lactic acid, which is providing you with a little bit more of an exfoliating effect, and cornmeal, which is a granular that helps to physically remove dead skin cells. Also, the gel mask has soothing peppermint that soothes and calms the skin, and also some freshwater alginate, which is a wonderful antioxidant and detoxifier. And then the rosehip whipped moisturizer provides you with mattifying benefits, controls oil, and soothes and calms the skin. And our ultra-sensitive system, which was launched last year. A new addition to our line that we can use on acne conditions, especially inflamed skin, includes a cleanser, a toner, an exfoliating mask, a whipped moisturizer, a body lotion, and it does have a complete facial treatment that you can do. Is a complete system from head to toe. It's completely essential oil free, and it's also dermatologist tested on sensitive skin. Not only can you use it on acne conditions, but also rosacea, dermatitis conditions, or allergic skin types. But because acne is associated with inflammation and sensitive skin, this would be a perfect product for someone who is going into that sort of really severe stages of acne. Grade 3, grade 4 would be the perfect time to utilize a very gentle product on a very inflamed, reactive skin. The other products, like for example, the products that I was mentioning have the strong anti-inflammatory effects, are going to be the perfect treatments to use on somebody with a higher grade of acne. The lesser grade of acne, you can get a little bit more aggressive, like with our AHA fruit peel and Hungarian paprika treatment. That would be something that maybe we would do after the inflammatory condition subsides, and we can start to, see a lot less, a lot less erythema is present. So that would be the time that we could start peeling the skin. All right. So we are going to do a live demonstration of the deep cleansing facial. And that's going to happen next. But what I thought is I'd just quickly pull up the deep cleansing facial protocol so you can see what we offer or what is available as far as product selection. So I'm just going to quickly stop sharing this presentation and switch over to the just pull up our deep cleansing facial protocol. So you can see what that looks like step by step. Here we are. The deep cleansing facial is a good facial. It's good for all skin types, but especially for problematic skin. This facial assists with clearing the skin of impurities and helps to restore balance back to the skin. The combination of herbs such as rosehip, rose petal, sulfur, stonecrop, and kind of just to name a few of the ingredients in this treatment, reduce inflammation, and lemon and stonecrop help to even out color tone, while plant estrogens balance the skin. So in this facial, you have quite a bit of selections to choose from, depending on the condition or the grade of acne that you're working on, and also depending on, hydration level, whether they're very oily or maybe they might be drier acne, kind of depends. So we give you choices in most of each section, mostly on every step of the facial, we give you choices to choose from. So for example, in the cleansing step, our first cleansing step, you would choose between, say, lemon or rose petal, depending on hydration level or the sensitivity of the skin. Step 2, same thing, choosing mineral or nettle. Step 3, choosing between the toners. What we usually do and how the line is designed is to treat the skin at the hydration level, but treat the specific symptom. This is a very broad facial that covers all skin types pretty much. But because it's a basic deep cleansing step, you can really customize it and tailor it to your client's needs, depending on where their condition is at and how severe the acne is. So just quickly overviewing, as you can see the choices in exfoliators, rosehip, spinach, and horse oil sulfuric, and I'll kind of go over the choices as I'm demonstrating about which one is best for what kind of skin. And then step 5 to tone after your exfoliation. Step 6, massage with extractions. Step 6 is to treat the skin with a mask. And then step 8 is your hydration. We'll apply eye cream, and then serum, and then moisturizer, and of course sun protection. Let me just grab your headband here and get that on for you here. Okay. So we'll start and begin with our cleansing milk. But what you also want to start with is if the client comes in and they're wearing some makeup on the skin, the best thing to do is do a consultation with the client. Talk about health history, talk about the condition of the skin and how long it's been there. Also talk about any medications that they may be taking or using topically on the skin. And if they've done any chemical peels or peeling and what kind of products they're using for home care. I would also have them bring in their products and show them to you because going through what they're using could also be a cause of why the skin is in the condition that it's in. So make sure you go through a very thorough consultation, and then after your first cleanse, do a skin analysis, looking through your dermoscope or your Woods lamp, and determining what the condition of the skin is and what grade of acne that the skin might be in. And then you can decide on what treatment would be the best for your treatment in your facial and then also for home care. Now, for Brittany, she has been controlling her condition a lot with the Alico Organic Skincare products. So what we're going to do is just continue that for her. So she has a little bit of inflammation happening in the chin and a little bit of scarring on the cheeks, but she's actually more associated with the typical female breakouts, I think, is all around the chin and the cheeks and around the mouth. And a lot of this, I think, we can contribute, or we can sort of blame it on some hormonal changes that happen throughout the lifetime in a young adult life. So we'll be introducing some of those plant-based estrogens into the facial as well. But first we're going to start with an eye makeup removal. And some of the supplies that I have here for my facial today are applicator sticks. I also have some round cotton pads that are cut in half and also whole round pads. I have a bowl of water, a pair of scissors. I also have some gloves for doing extractions and also 4x4 cotton pads for toning the skin and anytime if I needed to soothe the skin with compresses as well. So I'm going to take my first half round pads first and dampen those, and then just go ahead and take my lemon cleansing milk. I'm going to choose to use on Brittany for her eye makeup removal. And I'm going to take these damp cotton pads and just place those right underneath the eye area. So I'm going to have you look up towards me and just place those right underneath the eye. And then go ahead and close your eyes, Brittany. So those are going to stick right underneath the eye because we've dampened them. Now, this is going to be part of the eye makeup removal process, which are milk cleansers double as eye makeup removers. I'm going to dampen a cotton pad, or two of them actually. Pump cleanser onto the cotton pads. And just place those over the eye area gently. And of course, I forgot to mention, before you start cleansing, make sure you sanitize your hands with hand sanitizer first, or wash the hands, of course. That is the first step, because your facial with an acne cleanse has to be very sanitary, because we want to reduce any amount of bacteria that could possibly be. We don't want to introduce any more bacteria into the pores. Okay, so next I'm going to take one cotton pad, fold it in half, and I'm going to hold down the pad underneath your eye area. Take the pad with the cleanser on it and sweep across the eye area, back and forth across the lashes, over the brow bone, and also over the eyelid until the makeup is gone. The pad underneath the eye is going to catch all of that makeup. And then once you're done, you can remove the pad and throw your pad away. And the same with the pad on the next eye. Sweep gently across the eyelids, over the eyelashes. And inward circles around the eye area. And if you have any left over, you just simply sweep it up with your cotton pad. Okay, so next we're going to do our first cleanse. And the reason why we're going to use a milky wash is because these oil-based cleansers help to remove oil from the skin. The oil will break through the oil much better. So it's really for makeup removal. Now, if you wanted to, you could actually do the mineral or the nettle cleansing twice, but I feel like this also helps just to remove the oils properly before we get into another second cleanse. So I'm going to take about 3 pumps of cleanser in my hand, put that aside, and start to apply this directly to the skin. The lemon cleansing milk has the benefits of apples, so a little light exfoliating effect, very light, because the amount of malic acid in this cleanser is very minute. It's not a lot. Spread that across the skin, and if you start to feel it sort of soak into the skin or you're not getting a good emulsification, you can add a little water after applying, and then add another pump of cleanser if you have to. Cleanse for about a minute and make sure that you hit all the areas: neck, décolleté, chin, cheeks, over the upper and lower lip, the nose, the forehead, and around the eyes. And then take a hot towel or a warm towel, sponges, cotton pads to remove the cleanser. I'm going to steam in the next cleansing step with my exfoliating wash. And the steam is going to assist with the exfoliation and helping to loosen dead skin cells and soften the impactions inside the pores, and will aid in assisting in extractions. Also hydrates the skin and flushes the pores. All right, so I'm just going to pull my steamer over so we can steam her skin while we do the cleanse. And I'll be using the mineral exfoliating wash. This is my favorite for acne-prone skin because of its anti-inflammatory effects. It also has the antibacterial and the oil-controlling properties. It also contains flaxseed, which is a phytoestrogen. That's hormone balancing, and that'll also assist with controlling sebum and oil production. I'm going to use about 2 pumps of cleanser in my hand. At home, normally you just might need this 1 pump if you're just coming to the neck, but in the facial, I like to come all the way to the décolleté and around the shoulders and the neck and the back, especially if you notice there is activity on that chest, back, and neck area. Add a few drops of water, emulsify it in your hand until it becomes white and sudsy. The faster you move your hands together, the better foaming action that you'll get. Now be very careful of the eye area with this product because it will get into the, if it gets in the eye, it will sting, and that is not going to be fun for the client or you having to deal with somebody stinging the eyes, and you'll have to bring them over to the sink and flush them out. Cleanse for about 2 to 3 minutes with this cleanser. Remember, it is also a body wash, so you can recommend it for your clients to use at home in the shower if they're experiencing breakouts on the body as well. And remove the cleanser with a warm towel, sponges, or aesthetic wipes. Okay, I'm going to cut the steam for a second here, and I'm just going to tone the skin with a selection of toners. Now you can utilize any of our toners actually for this facial. The toner that I was going to choose for Brittany was the Stone Crop toner. And the Stone Crop toner is hydrating, but it's also brightening, and it also has some soothing and calming benefits, and it's skin regenerating. You can also choose your Rosehip toner, which is also great for impurities. It has soothing and calming benefits and antioxidant properties. But it's great for helping to assist with acne rosacea conditions because it helps to constrict the blood vessel. And then you also have rose petal toner. The rose petal toner is very soothing, but somebody with a little bit more dehydrated condition would be best with the rose petal toner. So we're going to take the Stone Crop toner, do a couple of spritz on the face if we do a spray, and I'm going to hold my hand over her eyes, make sure her mouth is closed, and spray behind the client with the bottle straight up and down, and spray once, let it fall slowly on the skin, and then spray again, twice, and then use my hands to press it into the skin. You can also do a splash by cupping your hand and pressing that into the skin, which is very soothing. It's also very hydrating. Or you can simply do a deep cleansing effect if you take your 4x4 aesthetic wipes and spray toner on the pads. This, of course, will provide more of a deeper cleanse, and it also helps to remove excess impurities, also any residue of makeup or cleanser that may have been missed. All right, good. Now, I'm going to actually use the exfoliator Spinach and Horsetail Exfoliator. And why am I going to use Spinach and Horsetail? Well, Spinach and Horsetail provides such a softening and a mineralizing effect, and she has a little inflammation around her chin, that this will cut the inflammation a little bit more for her because it has those anti-inflammatory benefits. It is a light exfoliator. It's not aggressive, but you can build up to the aggressive exfoliators after, or do those in between a deep cleansing facial. But what I really like is the softening effects that I get, especially if I want to do extractions. And someone who has got a little bit more work to do with extractions, this is a great one to start with because you get this remineralizing and softening effect. Now, if I wanted to even increase that emulsifying effect, I can add a little bit of Hungarian paprika gel to her spinach and horsetail exfoliator. That could be something as a customized benefit, and maybe even increase the price of the facial a little bit if you want to price it accordingly. But that's kind of up to you how you want to do that. But I will demonstrate that, and I want to do it a little bit with a little bit of steam on top of it. We don't always recommend that you do steam on paprika, but it can increase the emulsifying effect. It'll increase the stimulation a little bit, but it also increases the softening effect as well. I'm not going to put it on the whole time I have the paprika, but just initially. So we're going to take a little spinach and horsetail exfoliator. So I'm doing a little bit of mixology in this class for you, which is kind of fun. Because normally I won't do that in a webinar like this. But I think it's important because the deep cleansing facial is a customized treatment. So we can really kind of tailor it to what she needs. So I'm going to take about a teaspoon amount of the spinach and horsetail exfoliator. This has soothing peppermint in it as well. So if you wanted more of the cooling and the soothing and the pain, for someone who's maybe more cystic, that would be okay, to use it by itself. You don't have to use paprika or steam, and that'll really help with the soothing the pain and inflammation. And I'm just going to put this on the back of my hand and add a little bit of paprika to it. And I'm doing probably like about a dime size amount. And that is the Hungarian paprika gel. And I'm going to mix it in together. Got a little fire and ice treatment happening here with a little cooling peppermint and the paprika. I'm going to put a little on her décolleté. She has a couple of breakouts on that area. You can also gommage this off the skin. I wouldn't do it if there was paprika, but if it was used alone, you can use it as a gommage. You will get a very gentle, light scrubbing if you do use it with your fingers and work it in circular motions. We're just going to leave this to sit. And we're using it more of like a disincrustation, kind of pre-disincrustation treatment, softening and mineralizing with the paprika and the horsetail. And of course, bumping it up with a little bit of steam. Now, you may not be able to do the steam on everybody, but if she had if she had more inflammation than what I see and it was a lot deeper, I might not do as much steaming. I would really work on calming and soothing and reducing the inflammation and omit the steam. So while that sits on the skin, I'll do a nice back, shoulder, and neck massage just a little bit while we let that sit. Some stone crop body lotion and a little soothing herbs body oil will be really nice and soothing, especially to help to de-stress the client. Remember, we were talking a little bit about how stress can also be one of the causes of acne and also an aggravator. And if we can relax the client and de-stress the client, this would be the best thing for them to aid in helping to subside the condition. Now, if she was very inflamed and her acne was more grade, 4, she's probably right around a 2, sometimes a 3, just depends, I think. But she's really coming down, and then her skin's improved quite a bit. And I would do more of this kind of product sitting on the skin, not do a lot of gommaging or scrub, because that inflammation will just get aggravated with the friction that's caused. So it's best just to leave exfoliators to sit and soften the skin with a gentle enzyme peel maybe even, or even some of the alpha hydroxys, the fruit acids help to soften the skin, a gentle peel, and then also this type of softening effect from the spinach and horsetail. And I'm leaving this on for it's right around 10 minutes or so. And then after about 10 minutes, you can take it off with a warm towel or sponges. Towel works the best because it's a little bit of a textured product with all the chunks of plants from the spinach and horsetail that are ground together. Those are the granules. The plant is actually kind of creating a granule or by being crushed. And then you could use it as a scrub if you'd like. And remember, our products are multifunctional, so it is a body product too. So you can use it as a body scrub as well. So after about, ooh, she's getting a little pink. Looks good. Just a little pink though. She's not getting too warm. But we know that paprika then is working, and it's going to be helping to soften and emulsify, and you'll get some really good extraction work done. I would typically only extract open comedones. I typically will not extract or don't recommend to extract nodules or cysts. That's a no-no because you can really cause some damage and scarring. And the pimples and pustules can also lead into worse problems as well. So when you extract those, so I would only recommend extracting the open comedones. Now, if your state allows you to do so, then be very careful. And the closed comedones are typically a little easier to extract because they're at the surface of the skin, and you'll have to use a little bit of a lancet or something to help prick the skin and lance the skin in order to remove that properly. So before we go into any extractions, we're going to remove the exfoliator, tone the skin, and then do an emulsifying massage with Saponaria massage treatment, which is a disincrustation treatment, and then steam the skin, and then also then afterwards do the extraction. So I'm going to turn this off and save it for when we need it. We don't want it to run out. It's a little steamer. Oh, she's got nice and pink. And all that is body heat, elevation, circulatory effect. That's providing an oxygenating effect. Remember I was talking about paprika providing that oxygenating effect? So utilizing your paprika in the deep cleansing facial is a great booster. Even if you're not doing the AHA, you can use your paprika at this step with other exfoliators. And this is a really perfect example of how you can do that. It's not an allergic reaction. So just remember to let them know that this is not something that they're allergic to. It's the circulatory effect. It's increasing detoxification, and it's oxygenating the skin. This is healthy stimulation. And the phytoestrogen effect as well, that hormone balancing effect. So we're really getting a good treatment done here in our deep cleansing facial by adding that paprika. Makes it a little bit more fun and more interesting too. Good. So the toning step is going to be perfect because you want to balance the pH of the skin next after you exfoliate. So we've changed the pH of the skin. And then we also want to remove any residue of leftover product as well. And a lot of times after using a scrub or something like this, that will happen. And I'm going to take my 4x4 aesthetic wipes, spray toner on the pads using the Stone Crop toner. Sweep that across the skin. All right. And next I'm going to use the Saponaria and the Naria massage cream. This has the two herbs called Saponaria and Linaria, also known as soapwort and snapdragon. These two herbs provide a disencrusting effect and will help to emulsify oil in the pores. This is also a very important step in our deep cleansing facial. It also has the healing yarrow herb, which has a botanical with the soothing and calming and anti-inflammatory benefits and wound healing benefits. So this is an amazing product for this step. And it's also going to be a disincrustation treatment because of the emulsifying effect of the herbs. If you steam on top of it, that will increase the effectiveness of the treatment. And the warming massage from the hands will also help to soften impactions in the pores as well. Now, if they're very inflamed and they're more around that grade 3 to 4, grade 4 acne, then you want to be very careful with your massage movements and also how much heat that you're kind of applying to the skin at this time. Remember, heat and humidity can sometimes be a cause or a trigger, but it depends on the type of acne that we're working on. If there's a lot of inflammation in the skin, I may not be using steam at this point, and I might start to omit the steam. In the beginning, for the emulsification, it was okay, but at this time, depending on how inflamed they are, you decide if they're going to need the steam or not. I'm going to take about a teaspoon size of the Saponaria Linaria massage cream and use it all by itself, no oil added to it. Where you notice there's more inflammation, those are the areas I'm going to stay away from. And if the inflammation is all over the face, especially in the cheeks and in the chin and the forehead, then I would probably go for more of a lymphatic drainage massage. If you don't know a lymphatic drainage massage, there is one performed in our training massage video, so that would be a good reference for a manual lymphatic drainage massage. The lymphatic drainage is great because it detoxes and it stimulates lymph, and so it will help with the flushing of impurities. And it's a light, gentle massage, so it doesn't cause inflammation. So I'm going to start off opening the lymph on the décolleté area, 3 circles on the décolleté. Massage the shoulders and the neck with the thumb. If there's a client that has, like grade 2 acne, have a lot more comedones, and you're going to be doing a lot of work extracting the skin, focus your massage movements on those areas because it'll assist with softening the impaction even further. If you spend more time on those areas, you're going to be spending more time on extractions. I'm just going to finish up my relaxing shoulder massage. And let's go ahead and just do one round of lymphatic drainage. We're going to start there. Using just fine brushed movements across the lymphatic tract, starting horizontally with horizontal lines along the décolleté area. Clearing movements right above the underarms, and then onto the neck. These are going to be vertical lines that start at the earlobe down to the collarbone. And then working closer in towards the Adam's apple. And you pulse 3 times at the collarbone in between each line. And the lighter the pressure, the better, because if you get too much pressure, you're going to go right past the lymphatic tract. Never over the Adam's apple. Now for each section, we're going to bring it down all the way down to the neck and then clear it. On the forehead. 2 to 3 lines depending on how large your client's forehead is. And always bring it all the way to the hairline. If you don't, it'll get stuck because the lymph follows right along the hairline. You need to have very short nails to do a manual lymphatic drainage too. So that way you don't cut your client and make it feel uncomfortable. That was 1 round. And then for sensitive skin, usually start with 1 round. If they're non-sensitive, you can do up to 3 rounds. Most acne conditions with inflammation, you usually just round 1 or 2 rounds. 3 sets of clearing movements. I'm going to complete the rest of the massage. Avoiding a lot of movement on the chin area, because that's where I notice where most of the inflammation is on her. We're going to concentrate more towards the cheeks and around the hairline and on the nose is where we're going to concentrate the massage. With this kind of client, you're definitely going to notice more customization in where you massage. You might not always follow your typical same massage that you do on every client. I'm doing some petrissage now along the zygomatic arch, right under the cheekbone. Doing rolling movements around the corners of the mouth, along the laugh lines, and the nasolabial fold. That'll also help to work in that disincrustation treatment a little deeper in those areas. All along the cheeks. And same rotation on the other side of the face. I'm going to do some eye massage movements next. All right. Remove the massage cream. Next, with a towel from the cavity. And when you do your extractions, you won't run the risk of finger slipping or an extraction tool slipping. So it's highly recommended to take that massage cream off. For balance, if you wish, you can still steam the skin to keep the skin nice and soft and warm, but it will interfere with your dermoscope. So to be more accurate with your extractions, I recommend using the dermoscope, but the steam will fog up the lens. So you can utilize the techniques that I just used to keep that skin softer and warmer longer. Using the paprika, mixing that and customizing it with your exfoliator. Steaming from the beginning during the cleanse, and also utilizing warm face towels. And of course, that saponaria lunaria massage is one of Elika's tricks to help emulsify. All right. So next I'm going to take a 4x4 aesthetic wipe and I will dampen that. And usually at the beginning of the facial, when you do your skin analysis, you might be making eye pads during that time, or if you have a peel on the skin, it's a good idea to make eye pads, which I did not do, but we'll make them now. And it's just going to spray Stone Crop Toner on the pads for an aromatherapeutic benefit and also de-stresses. I'm going to cover the eyes with pads. You're going to start to see my facials and webinars are going to be featuring more electrical equipment devices that you are commonly using in facials today. In the office here, we do not have a dermoscope, so I'll be demonstrating a skin analysis and skin mapping webinar. We'll be utilizing that later to come, and then also a high-frequency facial and also microdermabrasion and microcurrent as well. That'll be a lot of fun because you can utilize a lot of our products with that equipment, and I'll be demonstrating how to do that in our future webinars. So I'm going to take 4x4 pads. I'm going to spray those with toner. I'm going to proceed with extractions. I like to start on the nose area. That tends to be the area where the skin will harden up the quickest around that hard cartilage. And if you press down and roll the skin, they come out very nicely with your two pointer fingers that are wrapped in the cotton. You can also use finger cots too. If you decide to use a comb extractor, that's a great tool to have on hand in case you get a hard to reach area. Or having trouble getting one out that you know is ready to come out. It's the positioning of the hands and the fingers that's tricky sometimes. They're coming out really nice. You can start at the top of it. I can see the top of my fingertip where the congestion is coming out. Looking good. I bet Brittany's relieved that the camera's not right on your face right now, huh? Although it would be fun to be able to see these come out, but they are coming out really good. Even she had a mealy on the top of the nose that just came right out on its own. Didn't even have to lance that one or anything. That's how effective the paprika and the saponaria is. Very nice. Now, after your extraction, I highly recommend that you use a soothing anti-inflammatory mask and also a serum. That will be very helpful for reducing inflammation and helping to reduce the amount of oil that's produced in the skin. And the serum that I would follow with immediately after extraction would be your herb infusion serum, and then use high frequency over that to assist with penetrating the serum more effectively and deeper into the skin, and then also use it for its antibacterial effects and soothing inflammation as well. Just came back on. Turn that off. These comedome extractions will assist with reducing the risk of these becoming pustules. So comedome extraction is a necessary part of the facial. And if you cannot get them out all at one time in one facial, you'll instruct the client on the proper home maintenance. And then have them come back in. Let them know when to come back in so you can finish your work. And because comedones are kind of stubborn things, and depending on how under control you have the home regime and getting the oil production under control, may depend on how much extractions you're going to be doing all the time. And hopefully it becomes less and less. Usually I don't extract more than 10 minutes because then you don't want to cause too much inflammation. And make sure that you get everything out when you do extractions. Keep pressing it until you see nothing comes out or until you see that clear blood come out, and you know it's done. Now the treatment you can do after your high frequency and serum application. Now I don't have the high frequency unit here today, but in a future webinar I will, so I promise. The next time I do a facial, I will be showing you high frequency in one of the webinars. And then you want to treat the skin with a soothing anti-inflammatory mask. My first choice after extraction is the 7-herb mask, but you can also do rosehip gel for maybe even some rosacea conditions. You can do stone crop treatment for normal or combination skin. You can do sour cherry gel mask for large open pored skin. And another one would be rose petal gel mask for more dehydrated sensitive skin as well. Okay, so we're going to tone the skin again because we need to flush out those pores and make sure any of the debris that we extracted, we get off the skin. So I'm going to take a toner pad, a 4x4 aesthetic wipe, spray it with toner. I'm going to sweep that across the skin, especially in those areas where we did extractions. I would love to do a little bit more, but we can't. We don't have time. And if you feel like the client needs an hour and a half treatment, I would book them up to an hour and a half, especially if they're going to be doing, more extractions, or you can even double up on treatments as well, like on your treatment masks. Just like with hour and a half massages, you never want to go back to an hour when you've had a full hour and a half. All right. Okay, so she's ready for her treatment mask next. And I'm going to do 7-herb mask for you. 7-herb mask is going to reduce any redness left in the skin, tighten the pores, also help to, it's a very antiseptic medicinal healing treatment. So it's really going to cut inflammation and help to provide antibacterial antiseptic cleaning as well. I'm going to use about a teaspoon. Put that on the back of the hand. They also have healing and regenerating properties from the aloe and stone crop, and also lightening properties as well. Wonderful. Now the next trick is to compress this mask. If you've ever worked with our masks before and you haven't compressed them or used steam on top of them or keep them moist in some kind of way, you'll notice that it's a very difficult product to remove. But it also helps the effectiveness of the product. By keeping it moist longer on the skin, you're keeping the nutrients active longer as well. You're also aiding in nutrient penetration and helping to push it deeper into your skin, but also, too, it does provide some soothing and calming effects, especially if it's a cool compress. So I'm going to use 4x4 aesthetic wipes. And you can also use like a gauze mask that's been cut out with the eyes, nose, and mouth cut out. But if you don't have those, you can simply use two 4x4 aesthetic wipes. Open them up all the way, and they stretch really nice. Hold under the chin, onto the neck, and then press it into the mask. This also provides a nice effect for the experience in the facial, for the facial as a whole, because clients don't usually do this for themselves at home. They can buy the mask, but they can't do the compressing at home. So that gives them a little special treat. And then to provide more of a deeply penetrating effect, I'll use a dry towel and apply that just like if you were removing the product. I did that corner to corner. Shove that right into the crease of the neck. Fold it over. Provides an occlusive barrier to trap body heat in so you get a better penetration of product. Simply fold it in at the top so it doesn't fall off and tuck it in at the sides. Make a little nose and mouth hole so that the client can breathe. And we're going to begin hand and arm massage. I'm going to use my Stone Crop Body Lotion and Soothing Herbs Body Oil. The Stone Crop Body Lotion can also help and assist with lightening, especially if they have darkening from any scarring around the shoulders and the neck and the back of the neck. And also then you get soothing properties from the Soothing Herbs oil. Now if you notice it's a lot of oil congestion, you can skip the oil as well and just do the lotion. But you get anti-inflammatory benefits from the oil if there isn't too much clogged oil and it's just maybe pigmentation left over, then it's okay. The body lotion and the oil can be used after bath, after shower, also anytime after any body treatments for hydration. The oil also assists with removing wax residue, so after any waxing services. The hand and arm massage will aid in de-stressing the client and really helping to relax them. So if you do a really nice hand and arm and shoulder and neck massage, it will really aid in helping to de-stress. So that way there's less chance of aggravating the condition when you are less stressed. So we massage on the neck, the levator scapula back there, and the bicep and the tricep when we pulled the arm back, and now we're doing a forearm massage. And then massage the palms of the hands. The mask should be on anywhere between 10 to 20 minutes. It just depends on the amount of time that's given to you from the spa. If they give you 50-minute facial, you'll probably have 10 minutes. If it's a 60-minute, you'll have about 15 minutes left to do the mask. If you're adding on an additional mask, then it would turn into a 90-minute treatment. We do have a 90-minute deep cleansing protocol as well as another option if you wanted to add on to the facial treatment. Okay, and we're going to do the other side. Start with some long effleurage massage in the upper arm. Here we're massaging the neck, the trapezius muscle, and the levator scapula. Massaging the bicep and tricep. And the forearm. All right, so our next step after the hand and arm massage is to do the hydration step. That includes the application of the treatment serum, eye product, moisturizer, and sun protection, and also the lip balm application too. And after the hand and arm massage, I'm going to sanitize my hands again. And then remove the compress, starting with the towel. And then next, the 4x4 aesthetic wipe. Moving from the forehead down to the chin and rolling them down sort of parallel to the face. Just in case it sticks to the skin, there's no pulling. There we go. I'll remove that with a warm towel. Now the product will be still nice and moist a little bit, so it'll be much easier to remove. Yep, feels good. Looking good. I don't see any swelling from those extractions, which is perfect. The pores are minimized. She's going to have a much softer, smoother texture. I was able to do a little bit more work on this side. This side, probably the next time she would come in, we do a little bit more work. I try to usually do it a little bit more evenly, which is kind of nice. You do a little here, you do a little here, 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 and you have a little bit more of an even texture. But I noticed as we were plugging away, kind of ran out of time a little bit. But that would be more ideal if you did a more even extraction all over, and then save, do the same thing every time they come in, so there's more of a more even texture. Masks like this one that have a lot of herbs and a lot of the skins and the peels of the plants, I would recommend doing a toner step afterwards again, because that toner step can really help keep it clean and help you in removing the product. Most of it's gone, but sometimes the leaves like to stick around, so I like to do a little tone and blot, and that'll help remove some of the excess product, and it feels more comfortable that way too to the client. So you're not rubbing and kind of fumbling around. Very good. Looking good, feeling fresh and clean. Okay, so I'm going to use the Herb Infusion next for the serum application. And I like to start with this first because I can go up to the eye area with the serum, up to the eye orbital bone, and then place the eye product over that. So all we need is one pump. This has the anise, the fennel seed, and the clove oil, providing anti-inflammatory, oil-reducing properties, and also hormone balancing effects as well. You can also apply this product under high frequency, under LED light therapy, under galvanic, microcurrent, or any other type of electrical device. But specifically for acne treatments, high frequency and LED light therapy would be great. And next I'm going to apply the fenugreek gel for wrinkles. The reason for this product is because it's a gel consistency. It's a little bit more, less emollient, so it's not as oily, it's not greasy, it doesn't have the corn germ oil that we have in our other products or heavier herbal oils. And it's also a phytoestrogen, the fenugreek. It's a fatty oil that's very plumping. It also has rosemary for toning and tightening the skin and the tissues around the eyes. And it also has potato, which is a very plumping effect as well. So we'll use that is your professional size, and it comes in a retail size that looks like this. And apply that around the eye orbital bone. In between the eyes, the eyelids. Perfect for oilier skin types because of its water-soluble gel consistency. You can also use electrical stimulation if you want to use this under microcurrent around the eyes. That's a great treatment for anti-aging treatments around the eyes. And then I'm going to finish with the apple and lemon whipped moisturizer. There are some soothing benefits in the apple lemon, but you also have the brightening benefits from the lemon and the softening effects of the apples. And for her, a little bit of the raised scarring, this will be wonderful for helping to brighten up the skin and reduce pigmentation. And it is not an irritating moisturizer at all. And it actually has some soothing properties in it, like peppermint. So I'm just going to take about a pea size of the moisturizer. It's also our second lightest whipped moisturizer. So it's going to be a nice light finish without feeling too heavy. If she were a really excessively oily client and it was very hot and humid or something like that, I might opt for just using the serum by itself, which is okay to do. Now I'm going to do hydration on the lip area, and I would recommend the mint or the lemon. The spicy cinnamon, it couldn't be an option, but if there's breakouts around the mouth, might not be the best option. Now, do you have a favorite flavor, lemon or mint? Mint, yes, sure do. Sometimes it's nice to ask what their favorite flavor is, so that way they don't put anything on their lips that they don't like, and then they want to spit it out or take it off. So they're applying the cooling mint lip balm, which can also be really nice for clients that are sensitive or there's inflammation around the lips or around the lip line, because it can be soothing. Some people break out right along that lip line. It's a shea butter and a beeswax-based lip balm. And so there's no petrolatum. And then, last but not least, we'll apply sun defense and then recommend home care afterwards. So this will be one pump or two. I like to do two, especially in the summer, and bring it down around the décolleté and the shoulders. One pump is all you need for face and neck. This is an aloe-based sun protection. It has aloe, stonecrop. It also has tomatoes, which are full of antioxidant protection, vitamin E, C, beta-carotene, lycopene. It is a cream gel formula, so it goes on creamy and then finishes as a gel. So it's ideal for layering over the top of another moisturizer. The titanium is micronized for a very nice finish. And then also titanium is a physical sunblock. It's broad spectrum, blocks against UVA and UVB rays, and bounces and reflects the rays instead of absorbing, which is much more effective. And it will even cut redness. There's milkweed and horse chestnut that help to soothe inflammation and redness in the skin. And the physical block of the titanium cancels out